Good morning and welcome to an episode of Fertility Talk. Today we're talking with none other than Dr. Heylen, Dr. Sulaiman Heylen from Cape Fertility. And he's been a speaker so many times with us, and we're always happy to have you. So thank you very much for joining.
You're very welcome, Leanne. Thank you very much for the invitation. It's always a pleasure to chat to you.
Pleasure. And then we today, as part of the World Fertility, we're going to say month program, we're going to talk about one of our topics is the hidden barriers of conception, understanding endometriosis. So
Yeah.
we're going to just get into the first question. For women who have been diagnosed with endometriosis, what are some of the most common ways it affects the ability to conceive naturally?
Yeah. So before we answer that question, we actually have to say what is endometriosis?
Yes.
Because endometriosis is something that's not supposed to be there. See, the lining of uterus, the inside of uterus, we as doctors, we call it the endometrium. So that's the inside of uterus. And every month when a woman has a period, there is what we call shedding of the lining. That means the lining comes down.
Yeah.
Now, what is endometriosis? It means that the endometrium grows outside uterus, usually on the back of the uterus or on the fallopian tubes and mainly on the ovaries, or sometimes in the bowel even. So endometriosis is lining on the wrong place. It's lining where it's not supposed to be. It's lining on the outside of the uterus, and that can have an effect on fertility. So now the question is, why can it have an effect on fertility? Well, the thing is not supposed to be there.
Mm.
And therefore, the body is going to see that, must go away and causes what we call an inflammation. So if you have an infection of a virus or a bacterial infection, then the body is going to attack it and causing an inflammation to remove the foreign object. Now with endometriosis, it's the same thing. So the endometriosis is there on your ovaries, and it's not supposed to be there. So therefore, the body is going to cause a local inflammation to try to remove the endometriosis. So it's an inflammatory disease. Endometriosis is an inflammatory disease. And because of the inflammation, it can also interfere with the interaction between your ovary and the fallopian tube, and therefore have an effect on the ovulation. So even if we scan and see that the ovary works well and there is good hormonal production and the progesterone is fine and we know this woman makes a good egg, the interaction between the ovary and the fallopian tube can be damaged because of the inflammation. So endometriosis is an inflammatory disease.
Okay.
And women with endometriosis know that very often because they've got pain from that.
Mm.
Now, there's only one part of the story because endometriosis can also cause anatomical abnormalities. It can form sometimes cysts or growths outside uterus, and the cyst, we call it an endometrioma, can have an abnormal anatomy, so it's a deformation of the anatomy, and therefore also, because the anatomy is abnormal, it can also cause then that there is the interaction between the fallopian tube and the ovary doesn't work properly. So that's why endometriosis can cause infertility because of inflammation and also because of abnormal anatomy. And this abnormal anatomy can sometimes be very bad because that inflammation can then subsequently cause scar tissue and adhesions. And these scar tissue, these adhesions can then really make that interaction between the female organs, the tube and the ovary doesn't work at all anymore. So it's both an inflammatory problem and an anatomical problem why there can be infertility.
Thank you very much, Doctor. Um, so our second question is endometriosis is often called a silent condition. What are some of the
Mm,
early signs women should look out for, especially if they are trying to conceive?
yeah. So endometriosis can have different symptoms. So you've got three types of symptoms that women can have. Women can have infertility, women can have pain, or women can have other associated symptoms. And the other associated symptoms are more vague. And so I'm speaking about sometimes other inflammatory problems in the body, like headaches, like joint pains, like brain fog, like tiredness, like vague abdominal pains. There are associated symptoms, but they are not typical symptoms for endometriosis. And I've got two typical symptoms for endometriosis, which is the pain
Mm.
and the infertility. So sometimes women have got no pain at all, and the only symptom that they have is infertility. So it could be that women come and they say, okay, I've been trying to conceive for 2 years, 3 years. We do all the tests, we find nothing, and then we check and see, okay, there is endometriosis. So one of the common symptoms is infertility. But then the question is, what are the other symptoms? That's pain. There are different types of pain. Painful periods, chronic pelvic pain, sometimes ovulation pain, and then pain during intercourse or when you go to the bathroom. So number one, number two, painful stools or painful urinations can also cause, it can also be a symptom of endometriosis. So very often women with endometriosis, they've got just bad periods.
Yeah.
And they go to the doctor and, oh, that's normal, just take some anti-inflammatories and things like that, and it's not further investigated. And I think that is the most common warning sign. So painful periods, I mean, every woman has got painful periods, but actually every woman has got painful periods. Periods should be not
Not
painful,
pain.
huh?
Yes.
Huh? I mean, they should be manageable. The pain should be manageable. So if you got pain and you take a Panadol and you feel fine, it's okay, huh?
Yes.
But if you got painful periods which knocks you out every month for 2 or 3 days, that you have to take strong painkillers for that, or otherwise you can't function anymore, that is a definitely a warning sign.
Yeah.
So it is very important that women who've got like that abnormal menstrual pain, and what is abnormal? Yeah, everybody is different, obviously, huh? But women that have got these serious menstrual pains, that it is important that that we take this serious, and that we look at it and say, because it could be an early sign of endometriosis. And then yes, chronic pelvic pain also, because women can have period pain, severe period pain, and then when the period is gone, they feel nothing anymore. They're absolutely fine. But some women with endometriosis have got chronic pelvic pain. That means they've got pain most days of the month. And not severe pain, but dull pain, and typically in the lower abdomen, sometimes going in the very lower back, and
Yeah.
or in the legs. And these type of symptoms are also a warning sign that could be endometriosis, and that certainly warrants further investigations.
Okay. Thank you very much, Doctor. Our
You're
next
welcome.
question is, can you explain how the severity or stage of endometriosis impacts fertility outcomes? Is it always related to the extent of the disease?
Well, no and yes. So you've got 4 stages of endometriosis: one, two, three, four. Minimal, mild, moderate, severe.
Mm.
Minimal means there's just a little bit of disease. Severe is very bad, and then it can be the in-between things. But then, yes, you've got sometimes women with severe endometriosis who
Mm.
feel nothing.
Mm.
They feel nothing, huh?
Mm.
I've got women with minimal endometriosis who've had multiple laparoscopies done in their lifetime because of severe pain, because they can't take it anymore.
Mm.
So the severity of the disease is not always associated with the amount of symptoms. It usually is, huh? I must say, women with
Yeah.
severe disease have more often severe pain than women, but it's not necessary, huh?
Yeah.
So this can also obviously depend on the local inflammation of the body response. And yes, everybody is different. So that is the same with everything in medicine. Everybody is different. It's not an exact science medicine. It's not
Yeah.
like mathematics. And we must also know that every human being is different. But yes, there is definitely no correlation between the severity of the disease. There is a correlation, but not absolute, between the severity of the disease and the symptoms. And women with very, very little disease can have very, very bad symptoms sometimes.
Yeah.
And we must take these symptoms, we must take these symptoms also serious, yes.
Okay. Thank you very much. Our next question is, many women only discover they have endometriosis after struggling to conceive. Why is it so often missed or misdiagnosed? And how can women advocate for earlier diagnosis?
Yeah. So there is a lot of studies that say the typical delay for diagnosis is 7 years to 10 years to 11 years.
Mm.
There is more and more awareness about this. And more recent studies say it's not that bad anymore. We're getting better now, and doctors getting better.
Yeah.
And GPs are getting better also. There's more awareness of that. And the diagnostic delay is a lot less now. And if young women, and I sometimes speak about, I mean, very often teenagers go to the general practitioner and they complain about severe dysmenorrhea, there is now more awareness that the
Yeah.
doctors say, okay, this
Yes.
is maybe endometriosis, and
Yes.
take things serious and start treating it or start referring to a gynecologist for that. So I think there is good progress, definitely, in the last year. And there's a recent study that they've done in the UK, and they looked at the national records over the last 20 years, and they've seen indeed that there is a very, very good progress in the diagnosis of endometriosis. But the thing is that it is not always, some women feel nothing, and some women have got no symptoms. And if there
Mm.
is nothing that you feel, and you've got no symptoms, and you don't try to conceive, then there is not going to be a diagnosis.
Yes.
And then the other thing is that birth control pills are a good treatment for endometriosis.
Mm.
So women that start birth control at a reasonably young age, sometimes for painful periods, and they take it for 10 years and say they're fine. And
Yeah.
we see that. So they're fine, they take it for 10 years. Now they are 28 and say, okay, they would like to have a baby. They stop the birth control, and after 6 months, they say, oh, I've got bad period pains. And there the symptoms start. And then we see that these women have endometriosis and has never been diagnosed because, I mean, they were fine.
Yes.
They didn't feel like having it checked out because they were absolutely fine and had no symptoms at all. So this because of the nature of the disease. It's not only because of the not being aware of it. It's because of the nature of the disease, which can give no symptoms. And because of the lack of awareness, but that is getting a lot better. And the young women now very often get diagnosed much earlier with endometriosis than it was 10, 15 years ago. So it's a very good progress that we are making here, actually. And programs like this definitely help a lot also. So
Thank
congratulations for doing something like this.
thank you very much, Doctor. Our next question is, what fertility treatment options are most effective for women with endometriosis? And how do you decide between surgery, IVF, or other approaches?
Yeah, that's a very difficult question. And
Okay.
I can talk a lot about that, and I'm going to. Okay. Um, but if a patient comes to you,
Mm.
and the first thing, what is important as a doctor, you must listen to the patient and must understand why the patient is sitting in front of you. Is she coming to see you because she's got pain or infertility? Does she want a baby or not? And what is the main reason that she comes to you? Because I always say you don't have to treat endometriosis. We are not treating endometriosis. We are trying to help a woman with a problem. We're trying to help her. So endometriosis is not a cancer. So we don't have to do something about it just because it's there. So we can have women, we diagnose with endometriosis, they feel nothing, they don't want a baby, so we can just leave it.
Yeah.
Yeah. And then for pain, and I'm not speaking about fertility, there are many treatment options that are not surgical, like the birth control pills, like Visan, like other medications that we can use that are usually pretty effective for treating pain related to endometriosis. So endometriosis-related pain with medication, usually we can help.
Mm.
Now, for fertility, it's a different story. For fertility, you've got surgical options and you've got assisted reproduction. So you can do surgery, and surgery, it's done via laparoscopy. So every single surgery for endometriosis should be done via laparoscopy or minimal invasive surgery. So there's no place anymore for conventional surgery, for open surgery in the 21st century for endometriosis. Because endometriosis, it must be done by laparoscopy. And that laparoscopy, it means we have to remove the endometriosis. And the golden standard is what we call these days excision surgery. So in plain English, we cut it out and we put it in a bottle and we send it to the lab. Huh? So we physically remove all the visible endometriosis. Because if you do physically remove it, then you see you've got the best results and the lowest recurrence rate. So the removal of the endometriosis means you cut it out and it's maybe done with somebody who does it a lot, huh? Not somebody who
Yes.
does it once per year, but somebody who does it a lot. And the old techniques of burning it or lasering it, I mean, that's a bit old-fashioned. The golden standard is what we call excision surgery. You cut it out. And that's good. That's good. That's an acceptable treatment option. And it works very well for pain and for fertility. It has got obviously disadvantages because sometimes it can be complex surgery, sometimes it can be dangerous surgery with complications. And mainly, if you are having endometriosis on the ovaries and we must remove this, we can sometimes what we call reduce the ovarian reserve, or in plain English, we can cut away eggs. That's not something we want to do, huh?
Yeah.
So for a woman who wants to conceive, you don't want to remove eggs from her body. And that is a very significant risk of endometriosis surgery and must be taken very seriously by every person who's starting surgery for endometriosis. So the ovarian reserve must always be measured before. And always alternative options must be discussed very carefully before we go and decide we do surgery. So it's not because there is endometriosis, there must be done surgery.
Mm.
Just see if it's really indicated to do surgery and if it's safe to do surgery. Because surgery must be done by an expert in ideal circumstances and make sure you don't cut away eggs.
Yeah.
Yeah, yeah. And then you've obviously got the other option is the assisted reproduction. That's artificial insemination and IVF. So artificial insemination means we take the sperm of the husband, we wash it in the lab.
Mm.
We don't wash it, but anyway, that's what it's called. We improve it in the lab. We add fertilization medium and all these goodies to it. And then we insert the sperm inside, deep inside uterus, as close as possible to the egg at the moment of the ovulation. That's an easy, non-invasive technique that is particularly useful in cases of minimal and mild endometriosis. And then you've got IVF, and IVF is, I always say that's my big one, huh? So we take out the eggs, we fertilize the eggs outside the body and bring the fertilized egg back inside the lady. So with IVF, we bypass all these anatomical problems. And IVF for endometriosis works as well as for other indications of IVF. Huh? It's got blocked tubes, or you've got a low sperm count, a husband with a low sperm count, or you've got endometriosis, doesn't matter. IVF has got similar successes. And actually, the success with endometriosis, we thought in the past is not good, but it's not true. Huh? So we
Yeah.
know that IVF success rates for endometriosis are pretty good and actually one of the best. So now, if a patient comes to you, and I see the patient sits in my office, and I give an example. She's 35, okay? And she's got a husband similar age, and she's been trying to conceive for 3 years, okay? And for the rest, it's fine. She ovulates, husband is fine,
Mm.
but she wants a baby, and she's got endometriosis. Let's say stage 3 or stage 4 endometriosis. We can do surgery for her, or we can do IVF for her. But there's no doubt about it that IVF is for her the best way to conceive. So the beginning of this year, we had a meeting here in Cape Town of an endometriosis congress, and there was a big surgeon from Germany who was talking about surgery for endometriosis. And there was somebody from Cape Town, and it was unfortunately me, who had to speak about IVF
Mm.
for infertility and endometriosis. And afterwards, the doctors had a vote to see what do they prefer now. And the large majority of the doctors said IVF is better for for infertility and endometriosis than surgery. And it's not because I know more
Mm.
about endometriosis than the German specialist, because he's world famous. And it's also not because I can talk better, because he can talk very well, but because endometriosis and infertility, we know that IVF works better. And very recently, at the ASHRAE Congress, that's a meeting that's always from the European Society of Human Reproduction, that was this year, the first prospective randomized study has been published. Now, there's a lot of difficult words, but it means a comparative study between women with endometriosis, and you do surgery or you do IVF, and you see what is the outcome. And the outcome was so clear in favor of IVF that halfway that you stop the study, because it's not ethical for these women to say, you have to do surgery. It was so clear in favor of IVF, they have to say to the patient, no, actually IVF is the best thing to do, okay? Because it will give you by far the quickest way to conceive. And I can give you some figures on that. If you've got a patient with endometriosis, then you've got about a 30% chance she will conceive after 1 year, and about a 50% chance she will conceive after 2 years. Okay, so that is a cumulative chance of success that she will have. She will have a 1 in 2 chance that she will be pregnant after. She comes for IVF, you've got a 30% chance that she's pregnant within 1 month, and a 50% chance she's pregnant within 2 months. So, I mean, it's much quicker for her to conceive than doing surgery. And I didn't say that surgery is wrong, because for young women or women with a lot of eggs, or sometimes other good reasons, for pain that's bad, or for medical aid reasons, if your medical aid covers for the surgery and not for the IVF, then maybe you should do the surgery. So that's a very good reason. Or you've got no good access to IVF, so it's not wrong to do surgery for endometriosis. But it is important that women understand that the quickest way to conceive is always IVF, and that there is a risk of surgery that you can cut away IVF, cut away eggs. So it
Yes.
must be done. In cases of infertility, it must be done by or a reproductive surgeon, so fertility specialist, or by somebody who's really experienced in that. It's not somebody who does it like only once per year. So
Okay.
there are different treatment options, and it's not always easy. And IVF is usually the best way, but artificial insemination or surgery are definitely valid options also.
Thank you very much, doctor. Thank you for that. I'm glad you brought in the stats. Always makes a difference. Our last question is for women living with endometriosis who are feeling hopeless about becoming mothers, what message or advice would you like to give them hope on their journey, to give them hope on their journey?
Yeah, that's a very good question. And you see, endometriosis, there's a lot more awareness about now, and it's actually very good that there's a lot more awareness about now. But if you look at women who are trying to conceive, we sometimes think endometriosis is bad, huh?
Mm,
It's actually not. So if you look at the studies also, and if you look at the recent data and at large population data, then we see that a lot of women with endometriosis, they just conceive spontaneously. It's not because you've got endometriosis, you can't have a baby. It's not because you've got endometriosis that you come and see me. No, okay?
yeah,
A lot of women do conceive spontaneously. And these studies have also shown that it's actually better to have endometriosis than, for instance, blocked tubes.
yeah,
Because if you've got blocked tubes, no, you probably will need IVF or surgery, okay? But if you've got endometriosis, a lot of women do conceive spontaneously, or they conceive maybe with just fertility drugs,
yeah,
or with just artificial insemination without doing the big surgery or the... So endometriosis is sometimes not too bad. I mean, it sounds like not a fair thing to say for women that have been
yes,
struggling with endometriosis for their whole lives. But if you compare it to other causes of fertility, the prognosis is actually not too bad. So there is definitely hope. And with a good approach, and with somebody who doesn't focus on one thing, but on everything, then there is definitely hope. So you must always look at the 3 treatment options for endometriosis, like 3 cycles that come together, huh? Medication, surgery, and assisted reproduction. So that means assisted reproduction means IVF or IUI or insemination, and so these things. So if you look at a patient with endometriosis, I must say these are the treatment options, and dependent on where a woman is in her life, you can decide on something. And the surgical option is something that should be sometimes reserved to the specific time in a woman's life. And so, for instance, she's 22, you diagnose endometriosis, you put her on medical treatment. Now she's 29, she would like to have a baby. That's the time to do the surgery. One good surgery in a lifetime at the right time. And then hopefully she can conceive spontaneously without further intervention. Yes, there is absolutely hope for women with endometriosis, and with good care, with more awareness, and with a lot of advantages in medicine. Because if we see what we have now and what we had 10 years ago, and new medication that is in the pipeline for endometriosis that is registered in Europe and the States already, not yet in South Africa. We're busy registering it. It will come, okay?
Yeah.
So if you ask me again a year or two from now, I will have more options that we can even do better. Then yes, we can get there. But endometriosis, we mustn't dismiss it, huh? And it's with good care, and sometimes we need help from psychologists, physiotherapists, even from other healthcare professionals to help women with endometriosis. But with good attention, most women can have good quality of life and can have a baby, as many babies as they would like to have with
Thank
good
you.
quality. So there's absolutely hope for women with good individualized care for women with endometriosis.
Thank you very much, Dr. Heylen. So Dr. Heylen is at Cape Fertility. Their website is capefertility.co.za. If you want to get hold of him, you go to the team members, you'll be able to find his details there and can contact him directly if you'd like to make an appointment. So thank you very much for doing this talk on endometriosis. It was so needed and much appreciated. Thank you very much, Dr. Heylen.
You're most welcome, Leanne. It's always a pleasure to speak to you.
Thank you. Have a great day further.
You too. Bye.
Bye.